So hello everyone, welcome to this education class called Breathing Through COVID-19. Don't panic and remember to breathe. This class is about educating the Black community on natural things they can do to support their health during COVID-19, get some information and knowledge of how they can support themselves. This class is brought to you by the Black Heritage Support Service. So let's get into this presentation. So let me give you a bit of brief information on who I am, what I do, and what qualifies me to speak to this matter. So my name is Matthew Henry. I'm a healthcare specialist within the field of sports medicine. My particular role is known as a graduate sports therapist. I specialize in musculoskeletal rehabilitation, physical capacity enhancement training, pain relief, recovery strategies, and natural health support, injury and sickness prevention. So how I do that is by the therapies and treatments listed on this presentation, which is physiotherapy techniques, acupuncture exercise, ANF therapy, breathing, clinical massage, nutrition, lifestyle coaching, alkaline herbal medicine, and sports therapy. So my education is within sports therapy. I completed a Bachelor's of Science degree, which qualified me to become a healthcare professional within sports medicine. I'm also a certified functional movement specialist. I've been practicing since 2008 and I've been working with athletes, professional athletes, semi-pro athletes, grassroots. I've been working in private practice with individuals who are either athletes or non-athletes. And currently I run a mobile practice from Birmingham City. So let's get into the presentation. So breathing through COVID-19 education class, what is it about? It's about educating the Black community on the following. What is COVID-19? Is the Black community at risk? How do we identify COVID-19? Is there any key symptoms we need to be mindful of? Also, is there anything or something that we can do to support our health during this time? If so, what is it and what can be done? So, coronavirus. So, what is coronavirus? Coronavirus is an infectious disease caused by a newly discovered virus known as coronavirus. The name COVID-19 is an abbreviation. COVID means coronavirus, infectious disease. The 19 comes from the year it was found, which was 2019. So, what did the numbers say? Are the Black community really at risk? So let's take a look at this. According to multiple reports, the Black and ethnic minorities are definitely at higher risk compared to white Europeans. The Black community in particular are 1.9 times more likely to die from COVID. So it is statistically significant. Another study was also done which highlighted the mortality within healthcare of workers within the NHS. Out of the deaths within healthcare, 63% were from the ethnic minority groups. However, from this 63%, 27% was from the Black ethnicities. So it is an alarming. So could I have COVID and what does it look like? So here on this table, you'll see three different columns of symptoms which are associated with COVID. Now, before we go through all of these, I just want to explain something. A report was conducted which highlighted that the Black community, when they're suffering with COVID or potentially suffering with COVID, a common symptom that they experience is fatigue. Now, this fatigue doesn't seem to be listed within common material, which also has led to the potential misdiagnosing of Black individuals when they call the 111 service, the NHS service. So please bear that in mind. If you are feeling fatigue, don't disregard it. Don't be passive about it. It could be something to be concerned about. So here goes. So some of the symptoms, commonly known symptoms, is fever, a dry cough, tiredness. The less common symptoms are aches and pains, sore throat, diarrhea, conjunctivitis, headaches, loss of taste and smell, a skin rash, discoloration to the fingers and toes, and the serious symptoms are difficulty breathing, or shortness of breath. Also, we've got chest pain or pressure, and we have loss of speech and movement. If you're experiencing any of these, please seek medical attention. These are serious symptoms, and it's better to be safe than sorry. So one symptom to be mindful of is difficulty breathing or shortness of breath. And the reason being is the first thing we do when we're born is we take a breath in, and the last thing we do before we pass away is we take a breath out. Breathing is an essential task needed just to stay alive. This isn't something that we should play with or underestimate. Shortness of breath is a key element to staying alive. So this is why we need to stay on top of this one. So can a breathing exercise really work, and can it help during COVID? Or is breathing exercises just a bunch of hot air and gas? Hopefully not. And by the end of this presentation, you won't think it's hot air or gas too. So what can breathing exercises really do? Well, there's tons and tons of research demonstrating the power of breathing and the far-reaching benefits it has on the whole body. It has the power to improve oxygen within the blood, assist in relaxation, improve anxiety or depression or mood. It can also facilitate pain relief, enhance your immunity, optimize your recovery, alkalinize the blood, and it can transform your sleep quality. It can also lower your blood pressure. And one particularly benefit that I'm particularly interested in is the increase in nitric oxide. Breathing has the power to increase nitric oxide within the body. Now, that's of significance because in 2005, some research was conducted on on how nitric oxide impacts viruses. So I just want to give a quick explanation around viral replication, which is the way a virus multiplies itself and spreads through an organism. So if you look on this diagram here, there's 6 stages that a virus goes through to multiply and spread throughout an organism. It first attaches to a cell, then it penetrates and gets inside the cell. At that point, it then starts to empty its contents into the cell. These contents then start to attach itself to the nucleus, which is on picture 4, is the solid purple disc within the hollow outline, the purple outline. At this point, when the contents of the virus gets into the nucleus, it starts to multiply, at which point it then separates from the cell and moves on to finding a new cell where it starts this whole cycle again. This is known as the viral replication cycle, and this is how viruses spread. Now, in this 2005 research that was conducted, nitric oxide was shown to be able to inhibit and slow this process from happening, which means potentially by increasing your nitric oxide, we could have the ability to minimize the impact and development of contracting coronavirus. So it may not have a chance to grow and develop into a full-on experience of coronavirus. So we can probably potentially keep it at bay by increasing our nitric oxide levels. So also, breathing exercises have been shown to help, and even in some instances totally get rid of asthma. It's also been very beneficial to patients and people struggling with chronic obstructive pulmonary disease and also chronic bronchitis. So breathing exercises are very, very powerful, and all of these conditions listed right here all have something in common, which is shortness of breath and difficulty breathing. So these are known as respiratory compromise. So what is breathing? How can we avoid respiratory compromise? So breathing is a process where we take gases into the body and also remove gases from the body. And how we do it is by a coordinated movement of multiple things within the body, from our nose to our ribs to our collarbones to muscles in our stomach to muscles between our ribs and different organs and glands. So how do we breathe? What is breathing? So breathing is a process where we're taking air, ideally through the nose, and it enters the body, moves down the windpipe and into the lungs. At this point, when it's entered the lungs, it then can slowly get into our bloodstream and oxygenate the whole body. Also, it can also collect carbon dioxide and other gases, which we can then breathe out, which is basically the reverse process of the first. So, and this is known as breathing. So, why is breathing important? Breathing is very important because there's multiple different aspects of our health that breathing can positively impact. So right here on this diagram, you can see there's three circles. One's called biomechanical, one's called biochemical, and one's called psychophysiological. Now these are known as the triad to breathing. So I'm going to briefly explain them and explain to you how they're all linked together and how this is one of the aspects why breathing is extremely powerful. So biochemical. So that refers to the different chemicals which are in our body, like nitric oxide, oxygen, carbon dioxide, how we take in air. So this is all known as biochemistry within the body. Now, depending on how we breathe, our biochemistry can drastically change. And if you was to hold your breath, carbon dioxide would build up, and that would cause a set of responses throughout the body. Now, if that was to happen, that those responses have the power to influence your psychology, how you feel, how you think, and this is known as, now we're getting into the psychobiological. Now, I don't know if you've ever noticed this, but depending on how you think and feel can affect on the posture that you hold. So if you're ever stressed, you may notice that you may clench your teeth and jaw bite. You may notice that you grip your fingers, you clench your fist, or you even might notice that your shoulders are moving towards your ears. Now, this is a sign of how our mind can be having an influence on our body. This is known as the psychophysiological response. Also, we also have biochemical, biomechanical responses. So biomechanical is just in reference to how the body moves. Can our ribs come up? Can our ribs go down? Can certain things move and have the freedom of movement to do the mechanics required to breathe? So for example, if I had a stuck rib and my chest wasn't able to rise up and come back down and it was just stuck down, I would have a lot of difficulty getting air into my lungs. Now, this would be due to a biomechanical restriction. Now, if I wasn't able to breathe because I had a biomechanical restriction, that would have the ability to impact my biochemistry, which would have the ability to impact my psychophysiology, and so on and so forth. So these three things, known as the breathing triad, are all linked together. So, breathing. So, how do we breathe? What are the different types and ways that we breathe? Are there different strategies? And yes, there is. There are different ways that we can breathe. Some people breathe with their mouth, some people breathe with their nose, some people breathe with their belly, some people breathe with their chest. So, I just want to quickly explain the two common patterns which are seen, and you can kind of break people down into these two categories, which is known as chest breathing or belly breathing. Chest breathing is a way that we take air into the body by raising the chest up and the chest out in front. And what typically happens is, as this happens, as the chest comes up and forwards, the stomach either stays still or flat. Now, with chest breathing, it's been linked and associated to different forms of respiratory compromise known as and which can be found in different breathing disorders. So chest breathing is not an ideal way to breathe. This is something that we need to avoid, and which, as we go through this presentation, it will become a lot clearer. However, on the other side, we have belly breathing. Belly breathing is an ideal way where we take in air into the body in a controlled manner, which is ideal for managing and monitoring and regulating and keeping everything nicely balanced within the body with regards to breathing and respiration, which is breathing, taking in air. So there's different things associated with this, so we're gonna start to go through all of these things. But before we do that, I just want to try to help everyone work out: are you a chest breather or a belly breather? And it's a very easy, simple task that you can do to find out. And if you can identify this, hopefully, if you're a chest breather and you can identify that you're a chest breather, you're in a position to now make changes and to see a difference. So if you want to find out, how we're going to find out is by placing one hand on the upper chest and the other hand on the belly. And if you just relax and just breathe, pay attention to which hands are moving. Now, if you've noticed that the hand on the upper chest is moving a lot more compared to the hand which is lower down, chances are you are a chest breather. If on the other hand you've noticed that the lower hand tends to move more than the upper hand, chances are you are a belly breather. If you are a belly breather, congratulations, you're on your way to finding to achieving great breathing health. So what's the difference between diaphragmatic breathing, known as belly breathing, versus chest breathing? Well, there's multiple advantages and disadvantages to these two different breathing strategies. Diaphragm breathing or belly breathing helps the body to get the ideal amount of air into the body safely and efficiently. It utilizes the majority of the lungs, both the upper and the lower, and it maintains what's known as the carbon dioxide to oxygen ratio. So what's this ratio? Well, this ratio is of major importance for your respiratory health. It's the thing that can either cause shortness of breath, could be one of the factors that causes shortness of breath, and it can also be one of the things that gets rid of shortness of breath. So we can use this balance between these two chemicals known as oxygen and carbon dioxide. So what is this ratio that I'm talking about? It's basically a relationship that exists in the body where there has to be a certain amount of oxygen compared to carbon dioxide. And if these two chemicals are not working together at a nice balanced amount, the body starts to adjust itself to make changes. So if I have more carbon dioxide and less oxygen, um, what the body will do is in this situation, it will open up the vessels so it can get more oxygen into the body and get rid of carbon dioxide. So it almost uses this relationship as a way to work out how we're going to change things. On the flip side, if I had too much oxygen in the body and a low amount of carbon dioxide, the body would see it as I have too much oxygen and I need to reduce the amount of oxygen within the body because it is not working ideally. The relationship's not functioning properly. We need to get everything back balanced. So how it would do that is it would start to constrict your lungs and your airway and make it difficult to breathe. That way, you would take less air in, which would then, over time, reduce back the ratio of carbon dioxide to oxygen. And that's one of the main things that we're trying to control when we're breathing. And this whole mechanism is one of the main things that we need to really understand to be able to benefit from breathing correctly. So chest breathing has its disadvantages as well. So disadvantages are you taking less oxygen into the actual lungs and body. Even though more air comes in as the chest rises, less oxygen actually gets into the body and into the lungs. Now that's for a number of reasons. The main one being, it's only when you chest breathe, it only utilizes the upper part of the chest, the upper lung. It doesn't use the lower lobes or the lower aspect of the lungs. Also, by breathing this way, it also negatively affects that balance between the carbon dioxide and oxygen within the body. So breathing is an actual key aspect of the things that we can do to manage and maintain our health and well-being. So realistically, what could be what's the answer to this COVID-19 breathing difficulty? Well, I think the answer is breathing. Breathing's the most important nutrient, and without it, we will pass away very, very quickly. So what we're going to have to start to do is break these old patterns of breathing shallow and with our upper lungs, and we're going to need to switch to a better way of breathing, which is a new pattern, a diaphragm breathing with our belly, and start to actually improve the way that we breathe and start to get the benefits associated with breathing correctly. So I want to quickly explain how do we breathe, and at the end of this presentation, I'm going to provide a video which will act as a tutorial or demonstration of how to follow the information that's in the rest of the presentation. So first thing we want to do is sit comfortably, find somewhere to either lie down or sit down that is comfortable and quiet. We're going to place one hand on the chest, one hand on the belly, and we're going to work out, are we a chest breather or not? How we're going to do that is by breathing gently in and out through the nose, which will just allow our natural respiration to take place. At this point, we're going to then start to focus on which hands are moving. Is our top hand moving more compared to our lower hand? Is our lower hand moving more than our top hand? Now, ideally, what you would like to see is a slight movement from the upper hand, or from the upper chest, and a lot more movement from the lower. Also, if you place your hands on the side, on your sides, if you breathe, you ideally want to feel expansion coming out to the sides. And this will help you to work out whether you're a chest breather or a belly breather. If you're a chest breather, please focus and try the following. Try to breathe in with your nose by drawing air in and down into the belly. You want the stomach to really expand and really focus on pulling air in from lower. And then we're going to pause. Then we're going to exhale and just gently empty the lungs. And we're going to be exhaling through the nose, and then we're going to pause. And then you're just going to keep on practicing this. Breathe in, pause, breathe out, pause, breathe in, pause, breathe out, pause. And the more you start to practice this, the more you'll be able to start to break the pattern of being a chest breather, where you'll be able to then slowly establish the way that we breathe from our diaphragm. So before anyone gets started with any breathing exercises, I just want to quickly go through a few things. If you're pregnant, please don't proceed. If you have a rib cage or spine or neck injury, please don't proceed. If you suffer with any dizziness, respiratory compromise, or any conditions where breathing exercises are contraindicated, seek out a medical healthcare professional who can support you. So now we're going to get onto breathing in a particular way for our bodies to be able to get the benefit, which will help us overcome breathlessness and optimize our respiratory function. So if you look on this slide here, you'll see there's 3 different exercises. There's one called the basic, there's one called if your nose is blocked, try this, and then there's one called more advanced. Now, ideally, you want to start with the basic. I wouldn't recommend going straight into the more advanced. So let's start with the basic. And to do that, what's going to happen is you're going to take 4 seconds to inhale. You're going to breathe it in for 4 seconds. Then you're going to pause for 1 second. Then you're going to exhale for 5 seconds. And then you're going to pause for 1 and repeat this whole process for 3 to 5 minutes. Now, all the while we're doing this, we're breathing in and out only with the nose. Now, if you do have a blocked nose, that exercise would be very, very difficult. I wouldn't even attempt it with a blocked nose. So if you do have a blocked nose, first try blowing your nose. If that does not work, I have an exercise for you, which I've found to be extremely beneficial and effective in unblocking the nose, especially during hay fever season. So how we do that is by breathing in for 3 seconds with the nose. Then we're going to pause for 1 second. Then we're going to exhale for 3 seconds. And then we're going to hold and pause for 5 to 10 seconds. We're going to then repeat that cycle we're going to then repeat that whole process for 5 cycles. So basically we're going to do it 5 times. In for 3, pause for 1, out for 3, hold for 5 to 10 seconds, do it all over again 5 times. And after you've done that, reassess your nose and to see if it's still blocked or if your nasal passage has now become clear. Chances are it will be after this exercise, but give it a try. Now, after you've done these two exercises and you're getting a bit more proficient and skilled at mastering or completing the basic breathing exercise, move on to the more advanced. Now it's when you get onto this where you'll start to actually see massive differences within your respiratory health. So how it's done is all breathing has to be done slowly, gently, and to the point where the hairs within your nose are barely moving. So that's how gentle your breathing needs to become during this exercise. You have to breathe in gently and you have to breathe out gently. And how we're going to do that is by breathing in for 4 seconds, pausing for 2, exhaling 5, pausing for 2, and then repeating that whole process for 3 to 5 minutes. And these are my breathing exercises, which will have a massive impact on your overall health and ability to breathe. So here I've got my big bonuses. I call it a layering effect. Now, if you do these two things, which I'm going to go through shortly, it will have a massive impact on your respiratory health and ability to breathe with less difficulties. I promise you, like if you give this a try, it will really work. So first, try doing a breathing exercise for 5 to 10 minutes every single hour for maximum benefit. Also, as we already know, that breathing increases nitric oxide levels. However, if you do humming while you're exhaling, it can actually times the amount of nitric oxide by up to 15 to 20 times the amount compared to normal breathing. So how that would look is something like this. So I'm going to take a deep breath in and then I'm going to exhale while humming. So it's Now, by exhaling with a hum, your nitric oxide levels will rocket. So, can we really know if these breathing exercises are impacting our health positively? And how can we know? Well, that's very easy to do. We can do a thing called a breathlessness test, which is a simple test which involves gently breathing and at the end of a exhalation, a breath hold, and then we set a timer to see how long we can hold our breath for before we get the urge to breathe in. And whatever this length of time is, it gives us an indication of how well our body is coping. Now, people with lower times, breath hold times, tend to have a greater likelihood of breathlessness, difficulty breathing, coughing, wheezing, both during rest and exercise. So, what's been shown is the breathlessness test can be used as a way to indirectly gauge if you're at risk of respiratory compromise. So, if you're doing these breathing exercises and your breathlessness test result improves, you've now just become less likely of having respiratory compromise. So, here goes. How do we do this? So, here's the walkthrough on how to do this breathlessness test, which can help you identify if the breathing exercise really worked. So, how do we do it? First thing we do is we're gonna breathe naturally without forcing a inhalation or exhalation. We're just gonna have our natural breathing pattern, and we're gonna continue this for a period of time until it's nice and steady. We're not hyperventilating. We're not taking in too much air. We're not breathing out too much air. We're just breathing normally how we would watching TV. If you're doing this exercise while I'm actually explaining, what I want you to do is at the end of your natural exhalation, I want you to hold your breath. And at the same time, when you hold your breath, I want you to start a clock or a stopwatch, and we're going to measure the amount of time that you can hold your breath. And we're then going to stop the stopwatch the moment you get your first urge or desire to take a breath in. Now, I don't want anyone to violently try to hold their breath for a long period of time. All I want you to do is just hold your breath until you feel natural urge or desire to take a breath of air in. Now that's when we stop the clock. I need you to work out how many seconds that was. Now, if you can hold your breath for a total of 40 seconds plus, well done, that's excellent. If you can hold your breath for 30 seconds plus, then you're within the good category. If your breath hold time is less than 25 seconds where it needs to be done, you are at risk of respiratory compromise, so you will greatly benefit from practicing breathing exercises. Now, if we follow the exercises that's been laid out within this presentation, you will see that over time your scores will dramatically change, and you can easily go from being at risk to good and slowly move into excellent. So now you know how to monitor your serious symptoms and how to help yourself. You know how to work out if you're a chest breather or a belly breather. You've got some different ways that you can breathe to improve and enhance your respiratory function, which will aid in reducing breathlessness and difficulty breathing. You've also learned how to test your breathlessness, which is a indication of respiratory compromise, and you can use this as an assessment to see if the breathing exercises are actually making a difference within your health. So I hope you enjoy these exercises. I hope you get a lot of benefits out of them. And before we come to the end of the presentation, I just want to give you a few tips on how to actually integrate these exercises into your life so you can support your health. So you can actually, without changing your life drastically, you could just do these breathing exercises in the morning on waking. You could do them while sitting on the toilet. You could do them before dinner, while you're in the shower or in a bath, or before sleeping. By combining these breathing exercises with tasks that you have to do every day, it doesn't feel like you're drastically changing your life habits. And by linking these breathing exercises to things that you already have to do, just makes it a step easier in implementing these exercises into your life. And this is pretty much the end of the presentation. Yeah, I've got some references if anyone wants to follow up and do some research. These references were all of the sources that were used to put this presentation together. Also, I've got some recommended sources and some books that I think are really good reads to get you onto the journey of learning how to transform your health using breathing strategies and techniques. And I would call these the key texts and the books that have all of the world's leading professionals and the experts on breathing techniques, and you'll find them in these books. And thank you for listening to this presentation. I hope you enjoyed it, and look after yourself.